All right. Hello, everyone. Good afternoon. Welcome to the second session of the SCORE webinar on the Middle East region. So we're very excited as we're having a very, very amazing speaker. We had the opportunity to talk we will not be discussing like other webinars on the dentics, prosthodontics, but we'll be seeing other aspects. What can you do elsewhere from dentistry as being a medical dental student? So it's a pleasure to have you with us, Dr. Mariam Baghdady, and I will be giving you the floor to present yourself to our audience.
All right.
May start the webinar.
Thank you very much for inviting me. It's always a huge privilege to be able to speak to the students. It's my favorite thing to do. My name is Mariam Baghdady. I'm an oral and maxillofacial radiologist, and I'm both a professor at Kuwait University and at the University of Toronto. And I'm very excited to be here today. I will start by sharing my screen, and we'll get right into it. Right. Let's get this to play. All right. I was just wondering, Mohammed, can you see my screen?
It's loading. Yes, we can. We most definitely can.
Screen is there?
Yes, it is. We can just try to change maybe the
perfect. I wasn't sure everybody could see my screen. All right, perfect. So today we're going to talk about the title today is Creating a Niche in Unexplored Paths in Dentistry, Challenges and Opportunities. So basically what we want to do today is kind of explore areas that you have the opportunity to be in, and maybe things that you haven't thought about, and really work through these options and work through some of these decisions that you make as you think about your path in dentistry and after you graduate. So technically, whenever we speak about dentistry, whenever we think about what are the things that we're going to do after we graduate, there's always this traditional path that we usually end up in. And traditional paths are two ways. So where do you work and what do you kind of specialize in? As of now, and I'll share some statistics related to that, usually people end up to be either in work in private practice, and they usually use their general practice degree or specialize or do some advanced dentistry in general practice. Then, of course, there's your sort of traditional subspecialties of dentistry, which are the ones that we all know, and then ones that we always think about, which are orthodontic, prosthodontics, periodontics, pedodontics, orthodontics, and oral surgery. So let's kind of look at this in numbers. So I'm just gonna. All right, perfect. I'm trying to get this out of my way. All right. So if we look at the analysis, the recent analysis by the ADEA, of course, these are North American numbers, but we can extrapolate some of that stuff even towards us within the Middle East. So this is an analysis of the 2022 ADA survey in US dental school seniors. So these are people that are just graduating or are going to graduate the year after. And when we look at their professional plans, you can see on this top area right here, people that are, if we look over here, we can see the total of all the students. And then over here, we can see something called HURE, which are historically underrepresented race and ethnicities. So these are people that are usually underrepresented within North American culture, and many of us can be considered part of that population. So if we look, we can see, I'm just going to draw your attention to the most important statistics in this area. And most people, so 53% of all students end up planning to be in private practice. And the interesting thing is, if you look down here, which this can be a little bit different for people within the MENA area and within the Gulf, for instance, only 6% end up to be in more government practices. And very interestingly, you can see that only pretty much 0.4% of students plan to go into teaching or academia. So this is sort of just setting the stage of where people want to work, or that's kind of, again, we're kind of looking at the traditional paths that we think about in dentistry, which is private practice. So this is, again, these are the numbers. This comes also from the ADEA. And I'm going to bring your attention here, and it looks at the enrollment in programs within, again, the United States, from 2018 up to 2023. And I'm going to draw your attention first to, let's look at the big winners, right? So most people end up doing a program in advanced education in general dentistry and general practice. As you can see, the numbers here are quite big. So you see about in 2023, you have about 1,100 students, and in advanced general dentistry practice or educational programs, you see about 791, right? So those are the big winners. And again, that's where people usually end up with general practice, right? So private practice and just doing general dentistry. So that's very typical. Now let's see what are when we look at the more traditional subspecialties that people end up in, you can see again, the big winners are the typical endodontics, oromaxillofacial surgery, orthodontics, pedodontics, periodontics, and prosthodontics. So these are the big traditional paths. Now, if you look between the highlighted, you're going to see the non-traditional paths of dentistry sort of pop up, like anesthesia and public health, pathology, radiology, oral medicine, and orofacial pain. But what I do want to bring to your attention is the percent changes that happened between 2018 and 2023. And if you look at some of these changes, you can see that something, for instance, like dental anesthesia has increased by 31.8% when it comes to enrollment, which is a pretty big increase over the years, rate of increase. The other one is maxillofacial radiology, also a 14.3% increase in registration. So these are, in other words, these are subspecialties that are non-traditional, yet they are growing and have quite an interesting future. So what we want to do today is expand our horizons. Many of us kind of while we're in dental school or when we're seniors, we sort of find ourselves struggling with not necessarily wanting to take that traditional path that is typical within the dental community. And we want to find ourselves, we want to expand outside of that and kind of expand our horizons. And sometimes in that senior year or the year before, you're like, I don't think I want to do this anymore. But actually, dentistry is considered a great platform or a great, and it's a great platform for you to start things that aren't traditional paths within dentistry. So if you find yourself in that area and you find yourself not really wanting the general dentistry, maybe not wanting the private practice life, maybe not wanting the traditional, exactly the traditional subspecialties, what do I do now? So let's kind of explore those options in the next little while. So how do we do that? I've divided it into 3 different ways to sort of look at your career and how can you go into these sort of unpaved paths in traditional dentistry. So the first one is looking at and exploring non-traditional clinical specialties. So as we saw before, we saw those very traditional clinical specialties. So let's explore things that are a little bit non-traditional. So non-traditional dental specialties are things like dental anesthesia, and we saw that that's grown significantly over the years. Now, dental anesthesia is one of the latest accepted specialties, or one of the latest recognized specialties within the ADA, and it's been accepted within Canada and most of the world as well. Oral medicine, oral pathology, oral maxillofacial radiology, public health, forensic dentistry. These are all areas that you could do a specialty that isn't very traditional. The other way of doing it is going into one of the traditional specialties, but getting yourself a niche or creating yourself a niche with a subspecialty clinical fellowship. Now, we hear clinical fellowships are very common, for instance, in medicine, but in dentistry, we also have some niche subspecialties now that are now offered all throughout the world, that you can then create a specific niche or a specific area of interest within a dental specialty. So for instance, craniofacial anomalies is a big one within orthodontics. TMD, temporomandibular joint disorders and pain, is really something you could do with any specialty, or even with general practice, that you can sort of create a niche and see very specific sort of patients. Dental oncology. This is something that is quite common within Eastern programs. So for instance, in Japan, Korea, and in China, they have a whole subspecialty of dental oncology, which sort of stems after dentistry, which is a very interesting specialty that if somebody's interested in that area, especially if you have more or less a dental medicine degree and you can practice within oral oncology in your institution. Maxillofacial prosthodontics. So prosthodontics is one specialty, but you can subspecialize into something a little bit more deep, and we'll talk about that in a second. And then you can sort of subspecialize within any clinical specialty into special needs patients. So now you're creating a niche with your patient pool. You can be more focused on a specific group of patients. So I know that I'm talking a lot and I'm saying like all of these things are possible, but let's be real right now and talk to a few people that have taken these non-traditional paths and now are thriving in a great practice in the niche that they've created. And I'm going to introduce my first, let's say, speaker. Our first speaker is a is a dentist that turned head and neck pathologist, and a good friend, Dr. Jassim Basteki. He did a dental degree and now is not an oral pathologist, but a head and neck pathologist. And let's have a listen to what he has to say.
Hi, my name is Dr. Jassim Basteki. I received my dental degree from the University of Pittsburgh in 2006. I then completed my postgraduate training in oral and maxillofacial pathology in 2011 when I was accepted into the one-year intense head and neck and endocrine pathology fellowship program, also in Pittsburgh at the University of Pittsburgh Medical Center. I currently am working as a staff head and neck and endocrine pathologist at the Ministry of Health of Kuwait. See in surgical routine and consultation head and neck pathology specimens, including thyroid and parathyroid from around the country. I also provide clinical diagnostic expertise, clinical pathologic radiologic correlation with the help of my radiologist colleagues as well. And I am involved in multiple head and neck oncology MDT meetings. I see patients in the clinic, and sometimes I also scrub in and operate. I take my own biopsies for select cases for optimum sampling and accurate diagnosis, and for better outcome and patient satisfaction. Finally, I am involved also in teaching and training dental, ENT, dermatology, and medical pathology residents, as well as providing CE courses for practicing clinicians in the country from the different dental and also medical specialties. I love how involved I am directly and indirectly patient care. also with helping improve the quality of healthcare system here in the region, in Kuwait, in the country. This gives me great sense of belonging, sense of achievement. I encourage all of you guys to be as involved as possible and offer your expertise to better the quality of health care provided wherever you're practicing. Know that you're a valuable member of any healthcare system you're working in, and take an initiative and make yourself and your expertise known and put yourself out there. There are so many patients in need for all that you can offer. And I wish you guys all the best.
All right. So that was Dr. Jassim Basteki, one of our head and neck pathologists in the cancer hospital in Kuwait. Again, dental degree, but created a niche for themselves within head and neck pathology through different programs. Now, my next guest is a dentist on oncology duty, and he is Dr. Badr Al-Kandiri, and Dr. Badr is a maxillofacial prosthodontist. So let's see what Dr. Badr has to say to us.
Greetings everyone, I'm Dr. Badr Al-Kandiri, an assistant professor at Kuwait University and a maxillofacial prosthodontist in my own private clinic. I received my DDS degree from the University of Missouri, Kansas City, United States. After that, I completed my postgraduate training in prosthodontics at Loma Linda University, California, United States. Once you become a prosthodontist, you have the ability or the choice to pursue it furthermore and go for a maxillofacial prosthodontics/dental oncology, which I have completed at MD Anderson Cancer Center, Houston, Texas, United States. Basically, dental oncology means we have to handle, treat, and care for the cancer patients prior to their treatment, during their treatment, and post-treatment as well. In the maxillofacial prosthodontics part, that's when we restore what's have been missing or removed surgically, whether it's due to tumors or trauma. And we restore it with a prosthesis. Most of these cases cannot tolerate further surgery, so they are left out without an eye or a nose or a lip or anything like that. Even intraorally, we restore it with a prosthesis. And most of those prostheses basically are removable. Now, what made me like this subspecialty, it's very unique and it's very difficult as well, but at the same time, it's very rewarding. And I'm not talking about money. It doesn't give you any profit in that way. It's basically makes you feel better about what you do, gives you a kind of purpose, because those patients really need your help and you can change their life drastically. The quality of life gets improved by you a lot. We're not talking about aesthetics, we're not talking about veneers or just some pain from a root canal. We're talking about changing their lives, giving them the ability to talk again, to eat again, to swallow, and to be able to smile and to go out in public again. I really hope this short video gives you an idea what's about. If you have further questions, I'm available. Dr. Mariam can give you my information and my contact information. You can contact me anytime. Best of luck.
All right, and last but not least, with this area of a unique or a niche subspecialty, we have today a dentist orthodontist who did a little bit more than orthodontics and took upon herself to do craniofacial orthodontics. She's actually still completing her last bit of her degree. I'd like to introduce Dr. Mariam Baghdady.
Hello everyone, my name is Dr. Mariam Baghdady. I received my bachelor degree in dental medicine from Kuwait University. Afterward, I completed my postgraduate studies in orthodontics and dentofacial orthopedics at Boston University. I did then 1 year of craniofacial fellowship training in special care orthodontics and craniofacial anomalies at University of Pittsburgh Medical Center. And currently, I'm applying to work as a craniofacial orthodontist back in Kuwait. So today I'll be talking to you about what's craniofacial anomaly, what's craniofacial ortho. It's a subspecialty of orthodontics that have been recognized as one of the few subspecialty in orthodontics and in dentistry that is accredited by the American Dental Association. And this 1 year of fellowship will give you extra training and knowledge in order to be able to function as a team member of something called craniofacial team. So the orthodontist is one of the key members of the team in order to be able to provide comprehensive care for patients with, for example, cleft lip and palate is the most common anomalies that we see, or patient with syndromes like facial microsomia, Pfeiffer syndromes, Crouzon, craniosynostosis, etc. The beauty of it, it's like you're not just working on moving teeth a few millimeters and providing better aesthetics or function. However, you're doing something more. You get to see the patients since they are a few days old and do like nasal-alveolar molding, NAM devices we call, and you will see them throughout the first 20 years of their life. So you will be a major part of their growing, and you will be treating them at different stages, preparing them for bone graft surgery, for example, preparing them for orthodontic surgery when they are done growing. So it's a really rewarding subspecialty and career by which you get to improve the patient's quality of life, and you're not only affecting the patient himself or herself only, but you're affecting the whole family, because when the patient is born with a craniofacial anomaly, the whole family is affected, and being a passionate craniofacial orthodontist is really meaningful for the whole family. So again, I just wanted you to know that there is a clinical fellowship in the United States and Canada at different places. There are 6 accredited craniofacial fellowships by which you can get the training in order to be a craniofacial orthodontist and help a lot of patients and teach also other orthodontists to be able to deliver such care. Thank you so much.
All right. So those are just real world examples of people that have created a niche for themselves within dentistry by taking a very unique path of education and taking a unique path in terms of studying a subspecialty. So there's other ways of doing it. You could be a general dentist. You could be a traditional. You could have a traditional subspecialty, but then you can create for yourself a research path. If you're interested in research, you can take a non-traditional path in research. So whenever we think about research in dentistry in general, we're always thinking about things like clinical research, clinical trials. It's actually quite rare, and as you saw the statistics, for people to get into academic institutions and to work on research, with the statistics we have right now, pretty much only 0.4 of dental graduates will enter that field. And even within that field, you always find that people usually end up doing clinical research. So there's a lot of non-traditional research paths that I've come across within my career, or I've come across when I teach graduate students. So for instance, neuroscience and pain is an area of dentistry that we're very closely related to, but not a lot of people do. Basic science research, even though we think people do a lot of basic science research, but it's actually not as common as you think when it comes to somebody with a dental degree. Biomedical engineering, healthcare's profession education, which is my area of research. We were probably only 2 dentists that did healthcare profession education research within my program. Throughout the entire program, we were probably only 2. And public health. And when I talk about public health, I'm interested in both, not only dental public health, but also public health in general. So I'll show you a couple of examples of that, an example of that, I'm sorry, in a bit. So let's do this again. Let's keep it real and hear from a researcher, a dentist with a general practice degree, and is a biomedical researcher. So this is our dentist turned scientist, and I give you Dr. Fawaz Az-Zabi.
Assalamu alaikum. My name is Fawaz Az-Zabi. I'm an associate professor at Kuwait University, Faculty of Dentistry. I graduated back in 2007 from Kuwait University. I worked at the Ministry of Health for around 3 years, and then I decided to do postgraduate training at the University of Pacific, where I did my advanced education in general dentistry for 2 years. And then I decided to do further training in implant dentistry and also get my master's and doctorate degree in education. One of our major requirements to graduate was completing a research course. And I think this is where I started my admiration for research and education. So I decided to join Kuwait University. And although I think that I had an excellent clinical training, whether at my postgrad and undergrad, I've always felt that the research component was relatively lacking in my career or in my training. And I've always referred to myself as a self-trained researcher because this is literally what I did. I wanted to be more involved with research, and this was the niche that I felt very comfortable with. And I felt that this will not only help me grow in terms of career-wise, but will also help me develop other skills that I couldn't acquire during my official training or formal training. So this is where I spend most of my time here now. I'm either in the office doing admin work as Vice Dean for Research, or as a researcher spending a lot of time here in the Dental Materials Lab, where I started really developing a lot of interest in that field. And again, I started my admiration for research back in dental school, but because of the nature of our career paths in clinical dentistry, we rarely think about other opportunities or other options. And this is where I decided to expand my scope and expand my mindset. And I would advise most dental students, or all of the dental students, to really expand the scope or their mindsets towards their career and explore other opportunities, whether in clinical dentistry or non-clinical dentistry, such as research or educational admin and leadership. These are wonderful careers that might not only help you grow and develop, but will also really create a wonderful niche for you that you can have a career of and enjoy very much, as I do.
So thank you, Dr. Fawaz, for that. Dr. Fawaz is our Vice Dean of Research, and as he said, he is a very good, amazing researcher in biomedical materials. So we spoke about, non-traditional clinical paths. We talked about non-traditional research paths. You could think about having a non-traditional work career path. So you can take paths that are non-traditional as well, even with a traditional degree in dentistry. So as we saw at the beginning with the statistics, 53% of people end up being in private practice, or that's what they want to do. And I think it'll be a little bit different within our communities, especially in the MENA area, in the Gulf area, where a lot of us do end up working within the government as well. So, but there are places that are non-traditional work paths that you can take, and you can create yourself a niche there as well. So some of these examples are, for instance, academia. I know academia sounds like something that we all do, that everyone is interested in and a lot of people get into, but in dentistry, as you saw in that statistics, only 0.4 of graduates end up in academia. Academia isn't one of those things that pay as well as private practice. It needs a lot more work, for instance. So academia is not always one of those things that people end up in. Public health, the public health sector, again, not a lot of dentists live in that space. Hospital dentistry. So when I say hospital dentistry, we mean a dentist that not only works within a hospital, but treats inpatient hospital patients, or basically really sick patients. Hospital dentistry is one of them. And again, this is sort of a way to create a niche with what type of patients you see. Working in industry. So industry is a huge area where dentists, with somebody with a dental degree can launch a career within. So industry within dental materials, within pharma, that sort of thing. Industry is a big, if you're interested in that. Media, in this new age, especially, media is a huge part of marketing and a huge part of the healthcare sector. So media is another place, if that's somewhere that you're interested in. NGOs, non-government organizations. Again, you can use your dental degree to work in sort of outreach programs, underprivileged areas within NGOs, for instance. There are different dentists that I've come across that work within underprivileged areas, whether that's in juvenile incarcerated facilities, or in different underprivileged areas. Leadership, policy, and regulation, that's a big area where dentists can kind of create a niche for themselves, whether in the government sector, whether that's in academics, or any area really in dentistry. Research institutions. So finding yourself within a research institution. So for instance, in granting forums, or in granting agencies that grant large sums of, for instance, dental research that is focused on, for instance, healthcare. It could be within medicine, it could be within dentistry, depending on your research background. But working as a working full-time within research institutions is something you can think about, especially within your country, wherever you end up being. Research institutions are available. They're usually external to academic institutions, and those are something you can think about as well. Forensic dentistry is also a work career path that people with general dentistry, or even prosthodontics and some of the more traditional paths, can end up working within forensic dentistry. Relief work and volunteerism. So people that sort of want to create a niche for themselves within, again, underprivileged areas, providing actual care, dental care, for underprivileged areas, whether that's in your own communities, or whether that's traveling to other communities to give that sort of care outside. And you'll see, and I'll give you an example in a little bit as well. These are things you can either do full time, or these are things that you can also do in tandem with the career that you have tried. For instance, a traditional career. So let's be real again, and let's take some examples of people that have dental degrees that have taken non-traditional work career paths with their degrees. So the first one is a good friend of mine, Dr. Bob Wood, who is very privileged, as he says, by being a dentist that treats the sick.
Hi, my name is Bob Wood. I'm a dentist. I received my dental degree from the University of Toronto in 1982, a general dental degree. I did a year of hospital residency, and then completed my master's at the University of Toronto in radiology, and my PhD at the University of Stellenbosch in Cape Town, South Africa. I returned in 1987 and started a hospital dentistry in addition to private practice. And I've been a hospital dentist basically ever since then. The aspect of practicing in a hospital is quite different than practicing in a private practice. And what you trade is you trade money for intellectual stimulation. So you can make a lot more money in private practice. There's no doubt about that. But you'll be bored. At least I think you'll be bored. I was bored, and I've done private practice off and on, and I'm back in private practice again now. But I enjoyed being part of something that was bigger than myself, and I enjoyed the idea of building a program and actually taking over a program that was already built and building it to an even better program at Princess Margaret Hospital, University Health Network in Toronto, and then handing it off to a new department head who's building on that. And I've always found that to be very rewarding. And the other thing is that practicing in a hospital takes fear off the table, because you see things that you're just not going to see in private practice, and you see them more frequently, and you learn not to panic, which is an important aspect of any practice endeavor. So I'd encourage people to take a look at hospital dentistry as a part of the profession of dentistry that perhaps you haven't thought of. I'm glad I did. I've done it for 32 years. There's been times I've regretted it. You are working in an organization, and that has its issues. But all organizations have issues. And I've felt privileged, and I've always said, and I think it's true to this day, that it's an honor to serve the sick. And try it out. I don't think you'll regret it. I haven't regretted it.
All right. So an honor serving the sick. I think that's a beautiful thing to think about. And we'll talk about a lot of the trade-offs that come with having a non-traditional path. And a lot of that is, money versus satisfaction or job satisfaction. But we'll talk a little bit about that in a minute. So the next person I don't have a video about, but I'd like to feature him. This is a dentist a dentist treating the underprivileged, and his name is Dr. Yusuf Al-Awadi. He's a pediatric dentist in Kuwait, and I think his story is very interesting because Dr. Yusuf Al-Awadi is somebody that kind of sort of has this idea of having sort of a traditional path within private practice with a pediatric degree, but has this side has this non-traditional serving the underprivileged on the side, which he does sort of in tandem with what he does, but it's a very big part of his career. Dr. Yusuf Al-Awadi is a pediatric dentist and founding member of the Kuwait Dental Mission within the Kuwait Dental Association, the KDA. And he goes all around the MENA area in underprivileged communities, in refugee camps, to work with children and to treat children that don't have access to care. And very inspiring kind of work that they does. And you can see here, he works with a team on the left-hand side. You'll see Dr. Mohammed Al-Awadi, who is a dental anesthesiologist that works with Dr. Yusuf. He has a full-time career in dental anesthesia, and he travels with Dr. Yusuf to do sort of the cases under GA, especially patients with special needs within these underprivileged communities that don't have access to care. And he goes everywhere, Lebanon, different refugee camps throughout the MENA area, and he's done amazing work. And again, this is somebody that's sort of built a career with both, private practice and volunteerism in his career. You can see here, these are all pictures of Dr. Yusuf within different countries, doing, providing care for especially children with special needs under general anesthesia. Oops. All right. And I think this is last but not least in terms of examples of the real world. This is a dentist turned public health expert, Dr. Lina Merdad. She has a very interesting career path, starting with a dental degree. Let's hear what she has to say.
Hi, my name is Lina Merdad. I'm a dentist by background. I have a bachelor's degree in dental science and a doctorate degree from the Harvard School of Public Health in global health. I started my career in dentistry in academia, and then very quickly I realized that there are two things that are important to me in work. The first is for me to be passionate about what I do, and the second is I really wanted to help people reach their full potential and have the largest impact possible. So very quickly, I realized that I had to move out of the dental field, and I chose to enter the public health world. I started to work as a consultant for national organizations like the MOH and other NGOs. I also started to expand my network regionally. So I worked as a consultant in research and in public health in the World Health Organization's Middle Eastern office in Cairo. And then eventually I moved to the WHO's headquarters in Geneva to focus on global governance and data analytics. I think if there's one piece of advice I'd give, it would be to push yourself out of your comfort zone, expand your networks, build your skills, and always pursue new opportunities. I think the good news is that dentistry is a great degree to launch from. So just consider this a journey and challenge yourself and just focus on what's important.
All right. So dentist turned public health world expert for you there again. So after seeing all these live examples, we've seen non-traditional specialties and subspecialties. We've seen non-traditional research paths. We've seen non-traditional work career paths. And as you heard from a lot of the people that are speaking, skills building is a really important thing if you do want to take that non-traditional path. So one of the things that you can do is considering a non-traditional path and consider in continuing education. So most people will find a postgraduate program in their interest and sort of within their countries, stay in their countries, take that kind of experience within a postgraduate program. One thing I do encourage is trying to get yourself out there and put yourself out there and go for a postgraduate training program in a different country than your own. And it's doesn't necessarily mean go to a North American program or a European program. Those are great opportunities, but the world is now your oyster. There are programs in the East that are very interesting. As I said before, there are areas in dental oncology, especially in places like Japan and Korea. There are places within Australia, New Zealand. There are different programs and different postgraduate programs within these countries. So really expand yourself and try to leave the nest and go elsewhere. And the reason why I sort of encourage that is for you to be able to expand your networks. As a lot of the people were saying in these videos, when you go and see a system that is different than your own, it's a good opportunity to learn a new skill that is completely new to you. It's also a great way to bring back a new skill or a new field to your own community. And again, expanding your networks, expanding the people that you know, expanding the people that you can work with outside of your smaller circle within your own country. So I know that we hear about a lot of people leaving and doing postgraduate training, but it is considered something that not a lot of people have access to, and it can be a difficult path. And that's why I'm considering it to be a non-traditional path. So leave that, leave your current area and try to train in a completely different environment. It's always very helpful. There are other there are also postgraduate training in non-conventional programs, for instance. So as I said, it can be very difficult for different reasons to completely uproot yourself and go study abroad or elsewhere, whether that's due to financial issues, whether that's due to a language issue or anything else. There are other non-conventional programs that have popped up in recent years that can really help you get new skills and improve your skills. So hybrid learning is a very big thing now, where it's kind of like an online on-site kind of situation where you don't have to be somewhere all year round, but you can be there, for instance, just for a month or two throughout the year, and you continue your work online. There's a lot of research programs that do that as well, where you can have two co-supervisors, for instance, as supervisors. So you have one main supervisor and another co-supervisor that is in your physical location. So you can have a co-supervisor somewhere else and your supervisor in your own country, and you can collaborate and create research opportunities for yourself that way. Of course, there's completely online programs as well, which you can use, especially if you're looking for a master's degree, for instance, that is non-clinical in nature. Those are very interesting. And then there are non-traditional paths like apprenticeship. These were things that were very common in the past, especially in the Arab world and in Europe and in a lot of Eastern societies, where you kind of shadow and work and train with an expert as an apprentice. And that is an excellent way also to gain skills, especially if being able to leave where you are is difficult. Apprenticeship, especially if you find somebody really good at what they do, is an excellent way also to build your skills. Obviously, that is a non-traditional path, but it is very much worth exploring. So now that we've sort of talked about all of these different ways to create a niche for yourself outside of the traditional path of dentistry, and it's something that you really want to do and you're going to think about, now we want to think about, what do I do? Where do I start? Excuse me. So the first thing you want to ask yourself is, what do I like to do? What is it now that you're in dentistry, stop and think, what is it that you like to do? Is it clinical dentistry? Is it non-clinical dentistry? Do you enjoy diagnostics? Do you enjoy teaching? Do you enjoy research? Where do you find yourself most passionate about within your dental degree right now, or when you think back to when you were doing your dental degree? So liking some, the next thing you want to ask yourself, what am I really good at? Like, am I great with my technical skills? Am I great with my diagnostic skills? Have I been told that I'm a good teacher? What do you feel your strengths are? Sort of your natural strengths. The other thing you want to think about is, where can I truly make a difference? And that's very specific to where you feel like you're going to end up working. So look within your community, look within your where do you feel there are gaps? Now, all of these things are great, but we need to, as I keep on saying throughout the presentation, we need to keep this real. With all of these good things, you also want to make sure that you are financially independent, right? So with all of these questions, how can I do all of what I want, but at the same time, continue to be financially independent? So our last Be Real example is going to be an example of myself. I'm somebody that took a very non-traditional path in dentistry, and I'll kind of tell you my story. I was an undergrad at one point, and I graduated from King Abdulaziz University, Faculty of Dentistry. And during while I was studying dentistry, I came to the realization that I really didn't enjoy the technical part of dentistry. It just wasn't my thing. And however, I did really enjoy patient interaction. I also found that I really enjoyed diagnostic sciences. So I loved pathology, I loved radiology, I loved oral medicine. Um, also found myself loving teaching and understanding how love teaching worked and how they differed from teachers that really weren't able to bring that knowledge out. So I was always fascinated by teaching and learning. And when I looked around me, I could tell that there weren't a lot of diagnostic practitioners. There weren't a lot of people in radiology. They were always short staffed. There wasn't a lot of pathologists or medicine. So I felt like that might be a gap that I can fill. So I'm going to present sort of my story to you. It's going to look more or less like a timeline, but I just want to make sure everybody knows that it wasn't a straight line to success. It was more or less like chutes and ladders. So you go up a bit and then you fall down a bit, and then you go up a bit and then you fall down a bit, and then, you know, the general trajectory is upwards, but it's definitely not a straight line. So excuse me, I have pretty bad allergies these days. So my story, as I said, I'm a maxillofacial radiologist, and I have a master's and PhD in medical education. I'm also a wife and a mom, which, you know, again, we're keeping it real. So this all started, I started out by graduating dentistry from King Abdulaziz University in Jeddah. I then moved to Kuwait, and this is where I got married, and I worked for a while in the Ministry of Health polyclinics, and I right away realized that general dentistry or dentistry in general from a technical perspective really wasn't for me. I then applied for a scholarship because I didn't have the means to be able to actually go on my own. And during that time, I started a family, and I was successful in securing a scholarship, and I got accepted at the University of Toronto Faculty of Dentistry oral radiology program. And I had started my program at the time as a young mother, and with a little one. So again, chutes and ladders, things were up, things were down. It's not a straight line. So it needed a lot of work. And then after I completed my residency and my master's, I applied for a PhD and a fellowship within medical education, because that's sort of where my area of interest was when it came to research. I expanded my family. I had more kids. During that time, I was completing a PhD and a fellowship, and having a hand being a young family with little kids. Again, chutes and ladders, wasn't really easy. And then after completing that, I moved back to Kuwait and started an academic career during that time. And again, more kids. So that's sort of my general journey myself. And if I were to divide it, I think there was a lot of soul searching at the beginning before I actually embarked on my education or my postgraduate education. I was sort of dabbling in different things. Again, I was working in a polyclinic. I did a little bit of pathology. I did a little bit of oral medicine. I really wanted to get a feel of what I really liked. And I think I did travel to different programs at the time to explore, for instance, what does it mean to be an oral radiologist? What does it mean to be an oral pathologist? So there was a lot of soul searching and active exploration during those first years before I embarked on my higher education. And, you know, my residency is just work, 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 get it done. And then those 5 years of PhD, working, studying, taking care of a young family, because as most of you know, that during during the years of our postgraduate training, we also are building relationships, creating families. So those are things that go hand in hand. And I think a lot of us, you know, can be concerned about that, but it can be done. They can be done together. It just, again, there are ups and downs, but it can be done. So when we look at challenges, what are the challenges? So taking a non-traditional path in general in anything always has its challenges. It's not as well paved, let's say, as a more traditional path. So the first thing, the journey may take may take longer time. So if you think about, if you're somebody that's going to do research and needs to do a PhD, that's obviously going to take you a lot more time than if you were to graduate and, you know, take a year of general dentistry and start in a private clinic. So your educational journey is going to definitely take a longer time. The other thing is you might have a long time when it comes to sort of your soul searching and what you want to do and sort of pinpointing your niche. So it is a journey, as Dr. Dina had said, try during that journey to build your skills, but you need to know that it does take a longer time. Barriers, financial barriers are always an issue. And I always encourage people that are going on non-traditional paths to try to secure themselves financially through scholarships, through different, to saving up. If you know this is something you want to do, saving up, working towards being able to secure yourself financially. So financial barriers is definitely a challenge. Creating your own opportunities. So we have to understand, and I remember this is a supervisor had once told me this, that having a degree or having a niche in a very specific area isn't always welcomed with open arms wherever you go. And sometimes you have to create your own opportunities when you're there. So putting yourself out there, I think Dr. Jassim Basteki had said that you need to, you know, you need to put yourself out there. You need to say what kind of skills you have. You need to sort of carve out your space, your niche within the healthcare system or within wherever industry you end up in, and really advertise for yourself. And put yourself out there for what you have to offer to wherever you end up. But definitely those are one of the challenges, that you have to create your own, many times you have to create your own opportunities in that sense. Now, I think this is a theme that you've heard everywhere, I think across the board, that it might not be the most profitable path. So a lot of people, when they think about dentistry and graduates from dental school, is that they're going to go out there and make a lot of money. Now, is it true? Yes, it is. And you'll find that in your own community, even in direct family. Oh my goodness, what are you going to do? Why are you going to do public health? You did dentistry, you did all these years, and now you're going to work in a government institution in public health. That doesn't make sense, right? So it's not the most profitable path, and you'll find that socially you'll be pressured into thinking about things that are more profitable. But it's not always about profit, but it's always something to keep in mind, that it's not always profitable as you would be in a general practice and private practice, for instance. Social expectations and pressure. Again, social expectations, you'll find that, you know, within our communities, sometimes, you know, you're a dentist, you graduated, you should be doing this, this, and this. Even within the medical community or the healthcare community, you're a dentist, this is what you should be doing. So you'll find a lot of social pressure and social expectations around you. So those are definitely one of the challenges that you'll find. It can be a really lonely path. Sometimes you're going to take a path where you're really the only one taking, or you'll be the only person within the institution within that with that certain niche. So sometimes it is lonely, but as a lot of our speakers said, networks. It's one of the most helpful things. But definitely, these challenges are things to keep in mind if you do pick a non-traditional path. So these are the challenges, but if you do what you love, what you'll find is that you'll have definitely long-term job satisfaction. You'll be a lot happier. Profitability in the pure sense of profit is not always just about money. And I think you've heard this as a constant theme as well within people that took a non-traditional path. As I said before, being financially secure, being financially independent is extremely important, and it's something that you should strive for, whether you take a traditional or non-traditional path. However, profitability is not just money. It can be job satisfaction. It could be feeling fulfilled in providing something that no one else is providing. It can be helping the underprivileged, the sick, as Dr. Bob said, or just people that don't have access to care, or as, for instance, Dr. Lina Miqdad was saying, working in NGOs are not necessarily very profitable, but you have a very large impact. And instead of your patient being that one patient, now you have the ability to change society. Now you have an ability to change the healthcare system, and your impact becomes more than one patient, and it becomes more or less the whole community. So your impact is going to be much more than you think. And being part of something that is bigger than yourself can be a lot more important to you than profit in that sense. Now, whenever you do anything you love, I know everyone, when you do something you love, it doesn't feel like work. I know that's cliche, but when you actually do something you love, you are much more productive than if you're doing something that you're not being fulfilled by. So definitely better productivity if you do choose to do something that that you love and not necessarily traditional. Overall well-being is very, very important, and that's something that you get when you do end up doing something that you really enjoy, even if it's non-traditional, with all the challenges that come with it. Overall well-being is something that you'll really feel when you do something that you really enjoy. So if you find yourself, not fitting in the traditional boxes, you're not here nor there, do explore non-traditional paths with your dental degree. There's plenty out there. I mean, today we just kind of scraped the surface, but do expand your horizon. Go for things that not everyone will go through. Create your own niche, carve your own path, and definitely this really applied to me. This is a saying by the poet Robert Frost. Two roads diverged in a wood, and I took the one less traveled by, and that has made all the difference. That definitely applies to me. I definitely took the one less traveled by, and I feel like it made all the difference in my own personal life. And all the examples that you saw previously, I think, have very similar feelings. And with that, I think I just owe a few thank yous to my speakers. If anybody wants to contact them or follow their journeys themselves, please feel free to do that. I'll keep this up for just a second. They all filmed their own videos and were very gracious in providing this information for our webinar today. And I'd like to also give a special thanks to my little video editor, my daughter, Miss Dana Al-Swaydan, who helped me with the captionings in the videos. And I'd like to thank all of you for your attendance. And here are my contacts. If anybody needs to ask any further questions, please do. And I think I'll hand it over to Mohammed, and we can have a discussion if people want to ask questions.
Amazing lecture as always. I'm very amazed of the journey that you took, Professor. It's very inspiring, to be honest. So I'm glad that I had the opportunity to attend your session, to be honest. So we will open the Q&A session for our attendees. If you have any question, please don't hesitate.
All right. Whoops. All right, I'll kind of see. All right, I have a few questions. Let's see if we have any questions here. Nothing in the chat.
Don't hesitate, guys.
But please, if anybody does have any further questions and would like to ask, my email is out there. My Instagram is out there. I'm more than happy to answer any questions. I have a question here. Is there a way to see what areas that are untapped? So, so the question here is there a way to see what areas are untapped? So I think my advice to anyone that has an interest, like, so I'm just going to give an example here from a student that had once contacted me about this. So I had a student that was interested in industry, so more or less like dental materials, engineering, that sort of thing, and was wondering how they could sort of get into that. So my best advice for you would be to actually find someone that is within industry and to, either not just meet with them, is to tag along with them, see what it means to be in industry, kind of live a day in the life of somebody within industry, and go and check it out and see whether that's something that you feel like that's something you want to do. And then if it is, start building your networks within this industry, whether that's visiting, whether that's getting a job, whether that's, even a part-time thing. And then from there, building sort of your network. And from there, a lot of doors are going to open. And I think the other thing that will also happen is you'll get a clearer picture of how to get to your goal, your end goal. So what are the educational paths that you should be taking? What are the skills that are required to be in these industries? You'll really get it from the person that is an expert at it. So that's my advice for sort of untapped areas. Somebody, I think I have another question here. I know it's a subjective question. What are the top 3 most profitable for fields, whenever traditional or non-traditional? So that is a bit subjective. So it really does depend on where you end up. Having said that, like, we all know very well that private practice in general is the most profitable area in dentistry. I think it's pretty clear. Now, there are things that seem traditionally more profitable, things like orthodontics, prosthodontics, but really any of them, any traditional dental degree is very profitable. Now, in fields that are non-traditional, that can be tricky. And it can be pretty subjective, and it depends on where you end up. I mean, people in media are doing really well. People in industry are doing really well. I think poor academics are probably lower on the list, but there are many ways to sort of, let's say, augment that by other things. So, working in academia and private practice is a very common thing within the dental field, in the medical field in general. I'm trying to think of other things. I mean, as we saw, Dr. Yusuf's story, he's a very, very successful pediatric dentist he owns his own private practice, but he does all the things that he's very passionate about on the side. So, you can keep it profitable and do something you're passionate about. But sometimes you can be so passionate about a certain area that maybe I'm an academic, and it's not as profitable as if I was in private practice, but you know, you can figure that out.
We have another question from Aya Khalil.
I have another question here. What opportunities should we keep in mind for networking? How do you network as a dental student? Is networking really important? So, yes, networking is very important, and I can't stress it enough. Networking is very, very important. So what do we do? How do we network? Okay, so networking, I mean, I'm not an expert at that kind of thing, but just being in the field, networking. So when it comes to networking, there's multiple ways of networking. One way of networking is just networking in your field locally. That's probably a great place to start. So network in your local community, in your local organization, especially if you're interested in a certain field. So let's say you're interested in radiology. I'll just give myself as an example. If you're interested in radiology, find out who are the radiologists in your area. If there isn't a neighboring radiologist, where is a radiologist that is closest to me, for instance, and start networking with that person. Visit their center, visit their area of work, create a relationship with that person. So locally, then definitely, if you want to start networking internationally, you can start moving towards internationally through conferences, through meetings, face-to-face. You can visit a program, you can, that sort of thing. And then, of course, there's putting yourself out there in terms of networking online. So I always say, find out what your best networking tool is locally and internationally. So for instance, internationally, you know, LinkedIn is a really important networking platform. Locally, I know a lot of people within the MENA area connect with each other through social media, depending on where you are. Facebook might be the biggest one. There might be other communities where sort of Instagram is important. There's a lot of Twitter feeds that are very specific to healthcare. So you want to figure out what's best for you locally. But internationally, I think most people have sort of that connection through LinkedIn and that sort of thing. So, but put yourself out there in that sense. So networking is, just going back to your question, very, very important, especially if you're doing sort of non-traditional areas. You want to start putting your foot in the door in different areas, locally and internationally.
If you guys have any more questions, don't hesitate. If not, please fill in the form. We just shared the link for the form. Fill in the feedback form to get your certificate. I'm going to share it again for the attendees. All right. So thank you a lot, Dr. Mariam, for the inspiring journey and giving out some insight on what to do, because like everybody after graduation has only one thing in his mind. In my country, at least, is open his own private practice, and we don't think at all about the other branch. So it's good to have an insight on that. And a lot of people are going to sleep today wiser, and they're going to think about their future in a more new way. So thanks a lot. All right, dear attendees. So we're going to close our session and see you on our third and final session of the Middle Eastern Regional SCORE Webinar Month. And thank you, Dr. Mariam, for having us. Could you please give us
Thank you so much for having me. It's been a wonderful experience, and wishing everyone the best of luck, whether you're going in a traditional or non-traditional path. Wishing everyone the best.
All right, thank you. Could you please give us the hosting privilege so I can close the session? Dr. Mariam?
Yes.
Yes, can you give me host privileges so I can close the session?
All right,
on my
sorry.
end?
I don't know why I can't
no worries.
hear as much. Can you kind of walk me through that?
You just can click on my name with the double click and
yes.
Make me
okay,
host.
Thank you.
Yeah.
Okay. Thank you for that.
No worries.
I think I saw your message before and I wasn't sure how to do that. Okay, there you go. Wonderful.
All right, thanks.
All right. Thank you so much.